This week's Ask Dr. Durie is an interesting question that touches on a topic that we have not discussed before. The question is, how common is thrombocytopenia, meaning low platelet counts, after autologous stem cell transplant? And the answer to this is fairly common, actually, because when you replace the bone marrow, many times we do not have a full reserve of platelet production capacity. And so that means that if there's any kind of stress, then the platelet count might drop low. And so for a few patients, there is not full recouping of the platelet production capacity. And so even without stress, the platelet count may run a little bit on the low side. But what is more common is that if there's any kind of issue or stress, then the platelet count will drop. And this is especially true with a virus infection, a cold or something like that, or any kind of illness. The platelet count could drop down into the low range, although usually not into a dangerous range. What is perhaps even more important is that there is a limited reserve for the use of maintenance therapy. And with the use of Revlimid, which is becoming more common, there may be a reduced tolerance to ongoing use of Revlimid, which will lower the platelet count over time. Over 6 months, over a year, the platelet count can slowly but steadily drop, meaning that the Revlimid dosage might need to be reduced, or possibly the Revlimid might need to be stopped. And so this awareness about a low platelet count after having had an autologous stem cell transplant is really quite important to protect your health, to be aware about this risk, the possibility of bleeding. And so the bottom line for this question is that low platelets can certainly happen, and it's important to be aware of it and be alert for any changes and make adjustments to maintenance therapy if that happens to be ongoing at the time. So very interesting and important question, and hopefully this clarifies this answer for the patient who asked this question.